So let's dive right into the causes of sinusitis. Sinusitis is a condition where your sinuses, which are the air-filled cavities in your skull, become inflamed or swollen. This inflammation can be caused by several factors, including viral infections, bacterial infections, and environmental irritants. Understanding these causes can help you identify risk factors and implement prevention strategies. First up, let's talk about viral infections. Did you know that the majority of sinusitis cases are caused by viral infections, such as the common cold? That's right. A simple cold can lead to sinusitis if the virus causes inflammation in your sinuses. The good news is that viral sinusitis typically clears up on its own within a week or two. However, you should still take precautions like washing your hands frequently, avoiding close contact with sick individuals, and keeping your immune system healthy to prevent viral infections in the first place. Next, we have bacterial infections. Although less common than viral infections, bacteria can also cause sinusitis. This usually happens when the sinuses are unable to drain properly due to inflammation, creating a breeding ground for bacteria. Bacterial sinusitis tends to last longer than viral sinusitis and may require antibiotics for treatment. To minimize your risk, you should focus on maintaining good nasal hygiene, such as using saline nasal spray and avoiding irritants that can cause inflammation. Speaking of irritants, let's discuss environmental factors that can contribute to sinusitis. Exposure to allergens like pollen, mold, and pet dander can cause inflammation in your sinuses, leading to sinusitis. Additionally, pollutants like cigarette smoke and strong odors can also irritate your sinuses. To prevent sinusitis caused by environmental irritants, consider using an air purifier in your home, avoiding exposure to cigarette smoke, and keeping your living spaces clean and free of allergens. Now that we've explored the causes of sinusitis, it's essential to take the necessary precautions to keep your sinuses healthy and reduce your risk of inflammation.
Remember, prevention is always better than cure.
So, make sure to maintain good hygiene, avoid the irritants, and keep your immune system in tip-top shape. Moving on to the next topic, let's discuss the symptoms and signs of sinusitis. Recognizing these symptoms is crucial, as it will help you determine when medical attention is needed. So if you or someone you know is experiencing any of these symptoms, it's essential to keep an eye on them and consult a healthcare professional if necessary. First and foremost, facial pain is a common symptom of sinusitis. This pain or pressure is usually felt around the forehead, cheeks, and eyes, and it can be quite uncomfortable. The pain might worsen when you bend forward or lie down. This happens because the inflamed sinuses are putting pressure on the surrounding areas of your face. Another telltale sign of sinusitis is nasal congestion. When your sinuses are inflamed, they can become blocked, making it difficult for you to breathe through your nose. You might also notice that your sense of smell is impaired due to the congestion. In addition to nasal congestion, you may experience a thick, discolored nasal discharge. This discharge can be yellow, green, or even brownish, and it's a result of your body trying to fight off the infection. Sometimes this discharge can also drain down the back of your throat, causing a postnasal drip, which can lead to a sore throat or cough. Other symptoms of sinusitis can include headache, fever, bad breath, and fatigue. These symptoms can make you feel pretty miserable, so it's essential to recognize them and seek medical attention when necessary. In summary, if you're experiencing facial pain, nasal congestion, and discolored nasal discharge, along with any other symptoms we've mentioned, it's important to consult a healthcare professional. They can help determine the cause of your sinusitis and recommend the appropriate treatment to get you on the path to recovery. Now, let's take a closer look at the anatomy and function of the sinuses. Understanding the role they play in our respiratory system will help us better comprehend how sinusitis can impact our overall health. The sinuses are air-filled cavities located within the bones of the skull. There are 4 pairs of sinuses: the maxillary sinuses in the cheekbones, the frontal sinuses in the forehead, the ethmoid sinuses between the eyes, and the sphenoid sinuses behind the eyes. Each of these sinuses is lined with a thin layer of mucus-producing cells called the mucosa. So, what exactly do our sinuses do? They actually serve several important functions in our respiratory system. First and foremost, the sinuses help to filter and humidify the air we breathe. As we inhale air through our nose, the air passes through the nasal cavity and then into the sinuses. The mucosa lining the sinuses produces mucus that traps dust, pollen, and other airborne particles, effectively filtering the air before it continues down into our lungs. In addition to filtering, the sinuses also help to humidify the air we breathe. The mucus produced by the mucosa adds moisture to the inhaled air, which is essential for maintaining proper function and comfort in our respiratory system. Another interesting function of the sinuses is their role in enhancing our voices. The sinuses act as resonance chambers, contributing to the unique sound of our voice. Now that we have a better understanding of the anatomy and function of the sinuses, it's easier to see how sinusitis can impact our overall health. When the sinuses become inflamed and blocked due to infection or irritation, their ability to filter and humidify the air is compromised. 56 notes. This can lead to difficulty breathing, discomfort, and increased susceptibility to further infections. So maintaining healthy sinuses is vital, not only for our respiratory system, but also for our overall well-being. Let's now discuss the various diagnostic methods used by healthcare professionals to determine the severity and type of sinus infection you might be experiencing. Accurate diagnosis is crucial for developing an effective treatment plan and ensuring you're on the path to recovery. The first step in diagnosing sinusitis is usually a physical examination. Your healthcare provider will ask you about your symptoms and medical history, and then examine your nasal passages for signs of inflammation, such as redness or swelling. They may also gently press on your face to check for tenderness around your sinuses. In some cases, imaging studies may be necessary to get a clearer picture of what's going on inside your sinuses. These can include X-rays, computed tomography, CT scans, or magnetic resonance imaging. These imaging tests can help your healthcare provider assess the extent of the inflammation, check for any structural abnormalities, or rule out other potential causes of your symptoms. Another diagnostic tool that may be used is nasal endoscopy. This procedure involves inserting a thin, flexible tube called an endoscope into your nose. The endoscope is equipped with a light and a camera, allowing your healthcare provider to examine the inside of your nasal passages and sinuses in detail. Nasal endoscopy can help identify any obstructions, such as polyps, that may be contributing to your sinusitis. In some instances, your healthcare provider may also take a sample of your nasal discharge or mucus for laboratory analysis. This can help them determine if your sinusitis is caused by a bacterial, viral, or fungal infection, which is essential for choosing the appropriate treatment. To sum up, several diagnostic methods can be used to determine the severity and type of sinus infection you might have. These include physical examination, imaging studies, nasal endoscopy, and laboratory testing. With the help of these diagnostic tools, your healthcare provider can accurately assess your condition and develop an effective treatment plan to get you on the road to recovery. Finally, let's explore the various treatment options available for sinusitis. The primary goal of treatment is to alleviate symptoms, reduce inflammation, and promote long-term sinus health. Depending on the severity and the type of sinus infection, different approaches may be recommended by your healthcare provider. For mild cases of sinusitis, especially those caused by viral infections, treatment may involve simple self-care measures. These can include using over-the-counter pain relievers and decongestants, drinking plenty of fluids, and getting adequate rest. It's important to remember that antibiotics are not effective against viral infections, so they won't be prescribed for viral sinusitis. In cases of bacterial sinusitis, your healthcare provider may prescribe antibiotics to help fight the infection. It's crucial to complete the entire course of antibiotics as prescribed, even if you start to feel better before finishing the medication. This ensures that the bacteria are completely eradicated and reduces the risk of developing antibiotic resistance. Nasal irrigation is another treatment option that can provide relief from sinusitis symptoms. This involves using a saline solution to flush out mucus and debris from your nasal passages. You can use a bulb syringe, a neti pot, or a specially designed squeeze bottle for this purpose. Nasal irrigation can help reduce congestion, improve breathing, and decrease inflammation. For chronic sinusitis, or cases where other treatments have not been effective, your healthcare provider may recommend surgical interventions. Surgery may be necessary to remove polyps, correct structural abnormalities, or widen the sinus openings to allow for better drainage. The specific surgical procedure will depend on the underlying cause of your sinusitis and the extent of the problem. In conclusion, various treatment options are available for sinusitis, ranging from self-care measures and medications to nasal irrigation and surgical interventions. Your healthcare provider will recommend the best course of action based on the severity and type of sinus infection you have. By following the prescribed treatment plan and taking steps to maintain long-term sinus health, you can alleviate symptoms and enjoy a better quality of life.